With this therapy, I have an effective method where I can inactivate and at the same time remove these tissue growths, which are present in condylomas, without scarring.
Condylomas, also known as genital warts, are a form of wart that can be caused by certain strains of the human papillomavirus. Condylomas usually occur in the genital area, but can also occur on the anus and in the mouth. They can affect both men and women and are generally harmless, but nevertheless unpleasant. Condylomas are transmitted through sexual contact, especially during unprotected sexual intercourse. About 1–2% of the sexually active population develop visible condylomas, while 5–25% may carry an undetected HPV infection, as it does not always cause symptoms. Warts can cause unpleasant symptoms such as itching, burning, inflammation, and even bleeding when rubbed. In a moment, we will see why phlebolysis has proven to be an effective treatment method.
Condylomas, or genital warts, are often highly infectious and difficult to treat, a topic that is also very shameful for many people. Yes, phlebolysis works with a tiny gold needle through which this high frequency and direct current is transmitted to the tissue. And depending on the size of the vascular or tissue growth, small growths can be removed directly during the treatment, or larger growths can be cut off from the base, from the supply. And then, over the next few days, they will simply fall off without scarring and completely pain-free.
The treatment was virtually painless. I wouldn't say it was painful. I would say it was a little unpleasant, comparable to, let's say, running a cannula over the skin with a bit of pressure, so it was a bit uncomfortable. And immediately after the treatment, yes, there was still some after effect, but it was gone within an hour and stayed gone. Nothing ever hurt again, nothing bled. It was totally easy. I was really happy and relieved. The parts were removed, and I still have peace of mind today. It's wonderful, and I'm very grateful for it.
The procedure is really a mini intervention, and yet this is how the regeneration of our body works. The immune system recognizes that there are dead cells here, that I have to do something here, that I am regenerating here. And because the trauma was less at the beginning, this healing process is easier.
The conventional treatment methods for condylomas are topical creams prescribed by a doctor, cryotherapy, laser therapy, and surgical removal. The choice of treatment depends on the severity of the infection and the location of the warts.
The outcome of the other procedures is simply suboptimal. There are scars, there is bleeding, there are recurrences. The viral load is not reduced, and the condylomas become more rather than less after the procedure. Condylomas are something we have never ventured into before because they have a reputation for being very, very difficult to treat. And with this procedure, there was not only the theoretical consideration, but also the practical experience. And I think that's brilliant. It makes being a doctor really fun.